We now have the Bernie O'Brien Oration every year that the meeting is in Australia, and we invite one of our international guests to give this oration. So it gives me great pleasure to invite Amber, who we've already heard from numerous times through this meeting, to present the Bernie O'Brien Oration. Thank you, Amber.
Good morning again. Thank you again so much for having me. Thank you so much for the invitation. It's been an extraordinary honor to be invited to give this address. And when I first started thinking about what I would like to talk about for the Bernie O'Brien address, I figured I would talk about the thing that I know well and I feel most comfortable talking about, which is microsurgery related to brachial plexus birth injury. And that felt great because I knew I already had some slides and pictures together and that would be all right. And then when I started talking to Neela about the confines of this talk or what the expectation might be, she said, this is usually something more personal and a little bit off-piste. And so what I would like to do today in honor of Dr. O'Brien is talk about my path to becoming a microsurgeon, to talk about some of the mentors who touched my lives in the way that Bernie O'Brien in fact touched some of the lives of the mentors who then impacted me, but talk about the thread that has bound all those experiences together, which is the thread of compassion and care in medicine. And so in order to tell you that story, I have to talk about where it started. And I was born in an incredibly small town in Central Oregon, which is the volcanic foothills of the Cascade Mountains. This is the home in which I grew up. It was built by hand by my father, and this was my mother. They were an extremely poor artist couple, and I was their first child in this town. And in this location, I was incredibly isolated from the effects of MTV and all of the other 80s cultural influences, but I grew up very cared for by my parents. Part of the isolation that we experienced while I was growing up was, in fact, because my father was the leader of a cult. It was a small religious faction, and we were being hidden from the government. And so although I was born in 1980, my birth certificate, as you will see, was not given to me until I was 5.5 years old, when my parents finally tired of having me in their home for homeschooling and sent me to public school. But this path of being hidden from the government and this cult influence on my life meant that my family eschewed all medical care. I did not see a doctor when I was born. My mother received no prenatal care. And the midwife that delivered me was in fact the baker that lived in the building behind us. And she hemorrhaged at the time of delivery and was taken emergently to the hospital, where she was checked in under a pseudonym so that my family would not be identified and I was not known to the government. One of the things that was fabulous about this childhood, though, was that my parents were artists, and I grew up in the home with my parents, who were sculptors and painters, who worked in clay and were potters, and many of the formative years of my life were spent sculpting in clay, and I think this had a very significant impact, obviously, on the career choice, which I pursued, which I often think about as surgical sculpting. I spent many hours with my family here. But when we think about the community that I came from, this was a very, very small town. There are about 3,000 people that live here now, but at the time that I was born, there were just a few hundred people. My father, in the context of this cult and his religious preferences, was very good at having children and very bad at staying married. And so I had 3 brothers and sisters. I also had 2 older half-brothers. I also had 2 younger step-siblings. I had 2 older half-sisters, and then some subsequent other half-siblings. And I think we actually, in and of our family, contributed significantly to the population growth in this community. But that type of upbringing is not one that prepares you for a professional career. It's not one that gives you guidance or mentorship or insight into how to behave in professional settings. And so as I embarked on this career, I feel like there were a lot of limitations in the way that I viewed the world, because I just didn't understand the way that people normally interacted with one another in professional settings. But there were some critical influences that I count as things that I am very, very grateful for. And although the cult that shaped my family's upbringing was certainly one that had some negative impacts, it was also one in which we thought deeply about gratitude. We thought about the blessings that were given to us, and we took time to acknowledge the things that were gifts in our life. And even though we were a family of incredible poverty, we were also the family in town where anytime someone homeless was passing through, the police delivered that person to our home, where they would get a shower, my mother would cut their hair, my father would minister to them, and they in turn would make us some small gift, which in this case was an airplane made out of a Coca-Cola can. As I mentioned, my family had homeschooled me initially, and that was again part of this religious perspective in life. But at a certain point, my mother tired of chasing all the children around from outside and forcing them back indoors to do their studies, and so they sent us to public school. And at that point, I was about 7 years old, and I was placed into the 3rd grade. And because I had learned things that were specific to the type of education my parents had wanted me to receive and not the education that the rest of the world received, there were many, many opportunities in my early education that led me to confront the difference in what I understood and what the world understood. On almost the first day at school in 3rd grade, we were given a quiz to identify the date of the day, and I had no idea what that was. The context of a date and how to write the date was something that was completely foreign to me. And I was mortified and embarrassed by this, and I didn't understand that I could ask for help because that was not the way I had been raised. And that sense of not knowing and knowing that I didn't belong drove me deeply to want to understand the world, but I was afraid to ask for how. And so I read a lot and I studied a lot as a way of trying to avoid making the same mistake again. Also, as part of going into public school, I had to see a doctor for the first time because I'd never been vaccinated. And the way that I saw that doctor was because this was a physician who provided free care to families who couldn't afford care, which was my family for certain. And I've actually written about the impact that this woman has had on my life for the American Society of Surgery for Hand. I think it was very significant that she was a woman physician. I think that gave me early insight into a career possibility that I might not have other envisioned for myself. But it also, in the setting of a family that was so primed to think about gratitude, set me up to start to think about medicine as a way that one could serve others and serve one's community. And so from my childhood, I take this very critical theme, which is a theme of gratitude and service. Knowing that I wanted to have those as part of my life and being so impacted by those, when I was in high school, I spent every summer working with our church group building homes in Tijuana, Mexico for families who had even less than we did. And when I was in college, I spent 4 months in Zimbabwe working in a hospital there. Now, at this point in time, I thought that I wanted to be a microbiologist, and I thought that I was going to develop vaccines as my way of helping those in the world who had less than I did. But this was my first trip out of the country, and through that experience, I had the opportunity to participate in many aspects of medical care as an undergraduate student, which I think are not things that would have been available to me otherwise. And of course, in that setting, as you can imagine, I got to experience surgery. And there, of course, is the aha moment that so many of us share when we recognize the thing that is meant to be our path. And so at that point, I knew that I wanted to be a surgeon, and with all of the influences of my family behind me, knew that something that in a reconstructive space would be where I would go. I ended up at medical school at Johns Hopkins, and again, thinking about the person that I was and where I had come from, that lack of professional polish and skill created a very difficult environment for me at many times, trying to navigate the complexities of an old school East Coast institution. And as the registrars are all well aware, because I told them during their course the other day, I failed the brachial plexus anatomy section in my first year of medical school. And just, there are so many opportunities that we experience and challenges along the way that become the fuel for us to become good at something later, rather than becoming setbacks. But I feel like it's an important disclosure to tell you I did fail that. I think when we look at where I came from, there are a lot of things that I identify about the culture of the Outback and the culture of the wasteland. This is a sticker that my brother gave me because my family also recognizes this about me, and you may recognize that sticker as the one that also graces Furiosa's car. I feel a lot of similarity with this character, and in fact went as her for Halloween several years ago, and I did make that costume myself. But that is truly someone that I think I identify with, and a path that I identified with, which was feeling very alone and trying to find my place in the world. I matched for residency in plastic surgery in a small community in Southern California. As these things are a match, it was just where I landed. But I had the great honor of being mentored by a woman named Sharon Kalina, who was one of Bernie O'Brien's fellows from 1990 to 1991. And when she speaks about Bernie O'Brien, what she talks about is someone who is a tireless mentor, who never wanted the spotlight for himself, but who supported those who he worked with to excellence and supported the growth of everyone around him. And I think she really paid that forward in the way that she mentored me, and it is something that has become a critical part of my life and focus. During residency, there were also some very difficult challenges that befell me, and very quickly at the start of my residency career, I lost my stepfather to an aggressive cancer. He was probably the closest thing that I had to a non-damaged parent. And my older brother, who'd been traveling in Ecuador, was assaulted and ended up spending 2 months in the ICU at the hospital where I worked, because it was the only place that we could arrange a critical care evacuation for him to stay. These were significant stressors, but in the context of residency, I didn't really have time to process or think about them, and I didn't really have space to heal from them. And so when I graduated from my residency program, I undertook a 1-week silent meditation retreat as a way of trying to create space for myself. This is not a situation where you have a mentor or a guru. This is not a situation where you have a chant. This is not a religious institution. This is just an opportunity to sit and develop peace and quiet within oneself. But it is also a place where you start to truly understand that pain is an inevitability, but as they say, suffering is what is optional. And I think this was a very important part and formative experience for me as I started to approach my practice and training in a deeper way. So from my childhood, we take the theme of gratitude and service, and from my adolescence, I started to understand that we can have mastery over our emotional responses to what happens to us in life. I undertook an orthopedic hand surgery fellowship. I was very lucky to match at the USC Keck program, which is in Los Angeles, where I worked with Milan Stevanovic, who was just a pioneer in the field and an incredible mentor, and who gave me great guidance and great opportunity. But really diverted me from my path, thinking that I would be a community plastic and hand surgeon, to someone who now wanted to pursue brachial plexus surgery and microsurgery at a high level. And so I took my first job in an academic medical center as a result of his mentorship. But before I went on to that job, I figured I should probably do another meditation retreat because I had found it so helpful the first time that I really wanted to deepen that practice. I wanted to start being more mindful, and I wanted to start being more present because I found that those were very helpful for me to start to surmount some of the challenges that I felt had come from my childhood, and I thought it would be a good setup for my practice. And I started my first job at age 34, which feels like such an incredible long time to wait. I was very lucky to start a practice where there were a lot of young trainees who were very interested in mentorship, and this opportunity to now to start shepherding others through their career presented itself to me and became an important theme throughout the rest of my academic career. But within a few months of starting that job, my father's Alzheimer's had progressed rapidly, and in keeping with the themes of what you've already learned about this man, he was eschewing medical care, determined to stay in the home, and with a plan for him to pass in the home. And I was very lucky to be able to take time away from work to sit with him for the final weeks of his life. In part, I felt that this was driven by a sense of guilt for not having been there for my stepfather during his passage. But there was also something that felt very circular and appropriate in that he was going to pass away in the same room where I had been born. He had been the midwife for my delivery into the world, and I would be his for his exit. And in order to prepare myself for that, I found an excellent book and read about this in order to be ready to how to care for someone while they're dying. It's not really something that we learn in our medical training. And what I found were some incredible parallels to what I had already learned in my meditation practice, that really when we're thinking about palliative care and confronting death and supporting someone who's dying, this is a form of meditation where our focus is not on presence and centered within ourselves. It is presence and centered with another person. And I felt that this really set me up to have a good experience caring for him, and one in which I felt ready to help him. This also had a lasting impact on my practice going forward. And I think as a lot of the conversations over the last couple of days have unfolded, one of the things that we've talked about is being present with our patients in time of discomfort, present through their pain, present through the not knowing how to manage a surgical situation in exactly the best way, and figuring out what is the right thing. And so those skill sets really built into something that I felt had a very powerful impact on giving good care to my patients. But thinking about my practice when I started, I was not the hand surgeon that you think of me. I was a hand surgeon doing exclusively breast surgery because that was what was available to me in this practice. I was the first hand surgeon that had been ever hired by their department. They had no congenital hand team and no specialist doing congenital care. They had no brachial plexus birth injury team and no one interested in providing that care. And so as the young, available, and affable surgeon, most of what came to me initially was breast reconstruction, and that's fine. It's good to be busy when you start. And truthfully, I might not have even been ready for all the things that I wanted to do, because if we look at the roster of what I had accumulated by the time I graduated from my fellowship, it truthfully was not a lot, and certainly not enough to qualify me as an expert in any of those domains. And I did only have 3 publications. I would like to point out for any of the young registrars in the audience, is like, you are undoubtedly doing better than I was. And so I embarked on a process of continuous medical education. And I think this is another theme that when I look at what Bernie O'Brien taught us and what he gave to the world, it's that international travel is one of the best things that you can do for yourself. It's one of the best things you can do for your community and for your trainees. The places where I went when I first started were to Changdong and to sick kids, because I wanted to understand how to take care of nerve injured patients and how to do that in a way that was competent, in a way where we were collecting data, in a way where we were providing excellent care. One of the things that this taught me is that if you want to be good at something, even if you feel like you aren't, the only way to get good at it is just keep doing it. And part of that means that you may have to go to the market in Taiwan and try stinky tofu, and it might be awful. And that might be your best smiling face when you've taken a bite of the stinky tofu. But it is still a really good experience. In that process of trying to connect to my community, I really started to reveal the deficiencies that I had as a person in a professional networking setting. Again, I mentioned my family had no professional credibility, and I had always been trying to work to understand those things and work to understand how to behave in social settings. I was not connected to my community because I had gone to such a small residency program that was not academically connected, and truthfully, I was not known by anyone. But if we reflect back to that same theme as before, the only way we get better at something is just by continuing to do it. And so I continued to travel, and I traveled, and I met an incredible number of people who taught me an incredible number of things and shared an immense amount of knowledge with me. It was truly a pleasure to meet each of them, to attend the meetings, and to learn from each of these extraordinary mentors in the field. I even traveled internationally to do mission work with some of them in order to better refine my surgical skill and surgical technique, traveling to Algeria with Elaine Chaubert and with my dear friend Aaron Berger to Tanzania for plexus missions. And I took all of those things back and did hundreds upon hundreds of cases with my own team, refining my own practice, learning from each of my mistakes, and growing as I incorporated all of the things that I had learned from all of the teachers around the world. But there was a cost to this incredible amount of running and practice building, and that cost, as you may imagine, is burning out. Over the years, that work really took a toll. There was depersonalization, exhaustion. I lost the joy in what I was doing. And at that moment in my life came the straw that broke the camel's back. Sorry, my mouth is so dry here. A few years ago, when my mother was diagnosed with a metastatic, very rare neuroendocrine tumor, at the time of her diagnosis, she already had advanced metastatic disease. And so now I was forced to take time away from work. It was not a choice. This was something that needed to be done. But about 2 weeks out of every month were spent away from my practice and in my rural home in Oregon, caring for my last living parent. And I cared for her through all versions of her sickness, through surgeries. And for those of you who have talked about your experience being patients, you understand exactly what I mean when I say that it is a different experience to be on the other side of medical care. You start to understand things in a way that is different than anything you ever experienced as the care provider. But through this time, I grew close to my mother and I grew close to my siblings. And I think it really started to help me understand this expression, what comes from Joseph Campbell. And again, something which had built on these lessons that have been slowly percolating through my life, that pain is inevitable, but our suffering is optional. And we have the opportunity to choose joy, even when things are incredibly difficult. And so, in part, I was choosing this joy with my mother because I thought, I know I have a finite amount of time with her. If I can get as much as I can from this time, then when she ultimately passes, I'll be ready. I will have spent as much time with her as I can. I will have asked every question that I possibly can. The grief won't be as much as I experienced previously with the loss of prior parents. And when it came down, this is the last day, the last photograph that we had together in the state of Oregon, there's physician-assisted suicide as a legality. And so when things became untenable for my mother, she chose to end her life, and her whole family could be with her on that day. But my selfish perspective that I was going to be ready for her death was in fact exactly incorrect. What I had done over those 2 years was built a very, very deep relationship with her, and her loss hurt me more than any other parent had previously. It was in fact a breaking point. And as much as that grief was profound, what happened on the other side of that was exactly the opposite of what you might expect, or exactly the opposite of what I expect. I found incredible renewed purchase in my life, in my practice, in the care of my trainees, in the care of my patients. I felt so much richness in my life in the face of that incredible grief. And I wanted to understand why that was. And so I started doing some reading and starting to think about what had happened, what the significant change in losing her had meant. And I think when we think about having emotional reactions to things in our space or caring deeply about our patients, people talk about compassion fatigue. They say, the more you invest, the more you care about these communities, the more likely you are to experience hurt and pain. And in fact, what the literature has shown us is exactly the opposite. The more we invest in care, the more we invest in our community, the greater buffer we have, the greater emotional resilience we have when challenges come our way. And in this space, I read an incredible book, which I think was very helpful to me as someone who likes to understand the world from a scientific standpoint, because this was all about the biologic experience of love and connection to other people. And so this woman has undertaken this incredible, putting people in fMRI scanners and studying hormone levels, and really found that when people experience love, or the sensation that they feel is love, there are three things that have happened. People are together, they're sharing an emotional response, and that there is biochemical synchrony that's happening. I think we're all familiar with the concept of mirror neurons, and I will talk a little bit about that. But love is really an activation of our mirror neuron system with another person simultaneously, and that's when we experience this. And what that means is that we don't just experience love with our significant other or with our parents or with our children, but love is something that you can experience with every person that comes into your practice every day, every trainee whose lives you touch. It's about connecting with them on a true level. And that these moments don't just have benefit for feeling good, but they actually have significant hormonal benefits for us as humans that protect us against heart disease, stress-related illness, and a number of other detrimental experiences in life. And there are things that you can do to make it easier for you to experience these things. There are daily practices that basically strengthen this muscle. And by fostering those connections, you improve not just your health, but the health of the community around you. And so this was very powerful to me in helping me understand what had happened in the face of my loss of my mother, was that she had inadvertently taught me how to do some of these things. And so I just wanted to take a moment to think about that when we think about the mirror neuron experience, which I remember reading about in medical school, which is that any of us experience the activation of our motor cortex simultaneously to watching some other creature or human perform the motor activity, but we have a suppressive system in our brain that prevents us from physically acting that out. The same thing happens when we think about emotions. And when we read the face of the person around us, we experience that emotion at some level ourselves in the biochemical pathways of our brain. That is the basis of empathy. It is also the basis of love. And so when we think about ways that we can strengthen our connection to those around us, there were a few things that this book laid out as practices that were easy and simple to do. One of them was just at the end of the day, reflect on the interactions that we've had with people around us and think about how they went and how they could be better and what we enjoyed about them, to have a habit of gratitude for the things in our life that have been good. And then she talked about a practice of meditation, which of course resonated deeply with me. There was a specific meditation that is discussed in this book called the loving kindness meditation. And what this meditation does is it asks us to draw into our mind the picture of someone that we love and care about deeply, to think about them long enough to start to experience that sensation of warmth and joy that we get when we think about the people that we care, and then think about ourselves in that space and think about others who are not that person in that space, to give yourself compassion and to give the world and community around you passionate well. And just by doing this, and doing this a couple times a week, once a day, you can actually strengthen your ability to connect to those around you. And it's been shown through her biochemical studies. And I think this really goes back to something that we've truthfully known for a long time, that we are who we act, we are what we think about. These become the content of our character. And by choosing activities each day that create love and compassion in our lives, those become stronger aspects of how we behave in the world. And so from my losses, we add this thread, that compassion is a muscle, and it's one that we can develop, and it's one that we can grow. It is better than just something that makes us feel good. When we look at the literature surrounding physician and patient care, there is actually a tremendous body of literature that shows us that compassion is beneficial to patients. When our patients believe that we care about them, they become more invested in their self-care. They are more likely to take the medications we prescribe. They are more likely to go to the occupational therapy sessions we prescribe. They are more likely to follow the instructions in aftercare that we give to them. There's been literature that showed that for patients who are undergoing breast cancer screening, simply believing that their physician is compassionate leads to a significant increase in likelihood that the patient follows through with their screening recommendations. Patients who have HIV or who are on medications to suppress their viral loads are more likely to be compliant when they think their doctor knows who they are and cares about them as a physician. Patients are more likely to recall the information that we give them, even when it's in the setting of difficult information or bad or hard circumstances, when they think that their physician has treated them with compassion or compassionately cares about them. So we see that compassionate behaviors modulate stress-related disease, not just in ourselves, but in our patient population when they feel that we are caring about them. And that's been shown in the literature again and again. Even for things as simple as the common cold, there are stress-related hormones that are lowered when patients believe that their physician cares about them. We have significant ability to impact the health of our patients by simply providing care, which reflects to them that they are valued by us. So when patients believe that they're being cared for compassionately, we see all these positive benefits. We know that when they hear us, that communication being a better, more effective street also allows us to get more information from them. We are better at taking histories. We are better at making informed consent and shared decisions together when they feel like they're working in a space with us. Ultimately, when we're caring for our patients compassionately, we are more likely to get them a good outcome. But nothing is more important than medical excellence. No amount of compassion is going to solve the problem of 9 centimeters of someone's median nerve being harvested inadvertently instead of an FCR. And so I do think that this is important for us to talk about. What if being a compassionate physician, though, actually also meant that we delivered higher quality care, or we're better at doing the jobs that are necessities within the physician world? And there is actually evidence that that is the case as well. So registrars, or residents as we call them in the US, who have been scored with low physician compassion are also at significantly increased odds of making medical errors. High compassion scores are also correlated with competence scores in multiple studies that have been performed across the medical literature. So we know that patients do better. We know that we do better. And it is in part because this is just the biology of what it means to be a human. This is why we have these hormones. This is why our brain exists the way it does. This is part of being in a society and community together. Compassion is the glue that binds us. But that's all nice. Does it actually impact things which the government cares about? And in fact, yes, it does. Compassion also helps healthcare systems because physicians who have been rated as compassionate are less likely to spend unnecessary money on diagnostic tests, less likely to refer their patients unnecessary to other specialists, and more likely to be cost-effective in the care that they provide to their patients. This has been shown across multiple studies controlling for multiple different factors. And patients are more likely to choose a physician who they think is compassionate. They are in fact willing to pay more to see a physician who they think is compassionate. And so this is truly driving some aspects of revenue for our systems as well. In the US, we have this government reimbursement system, which may be slightly different or slightly similar to what you have here, but actually a significant portion of the way the government decides how much to reimburse the healthcare system in the United States is based on the patient surveys of what their experience was in that hospital center. Patient appreciation of the care they get drives reimbursement in the United States significantly. These are values to offering compassionate care that extend just beyond a good feeling that we have. And we know that the cost of physician attrition is incredibly high to institutions. When we have to replace a physician, train someone to take their place, there's actually something on the order of $500,000 to $1 million US cost to an institution to do that. So if we can prevent burnout, if we can help physicians feel greater joy in the workplace, these are also cost value adds to a system that supports compassionate care to patients. So what I would like to do is give you kind of a concrete example when we think about these things. When we think about a patient who presents with something like an appendicitis, this is a pretty straightforward situation. The general surgeon takes out this woman's appendix. Compassionate care has been provided. But when we think about what we do as hand surgeons, when we have the young woman who comes in with a crush injury who needs a reconstructive procedure, when we have the older patient who has recurrent Dupuytren's contracture and we're trying to figure out what to offer this patient, when we have the family coming in with a child with cerebral palsy, these are complicated decisions that necessitate that we understand more about who our patients are and what they need in order to deliver them the best possible solution. And so I would say this is what makes hand surgery special among so many specialties. we have the opportunity truly to sit with our patients. Literally, that's how we usually approach them in clinic. We sit with our patients. We hear their story. Our history and physical explicitly demands that we ask what they do for their occupation and their hobbies. We have a better situation in which we are primed to understand our patients and offer them compassionate care. This also gives us the opportunity to heal them in a deep and profound way by connecting to them in those spaces and not just their injury. And it is what is truly the joy of hand surgery. When we think about even just the Latin root of compassion, it means to suffer with. And I think, I'm trying to remember who said it yesterday, but someone had talked about experiencing the sadness when things don't go well. This is exactly what that is. This is experiencing the sadness with our patients. Jeff, was that you? I think that was Jeff that said that yesterday. It's something that we get to do with our patients almost every day. It's fundamental to being a hand surgeon. So what I would say is, in a field where we think so much about patient compliance and patient-reported outcomes as driving success in what we do, compassion has incredible potential to offer us an added value for our patients and added opportunity for excellence in outcomes in a way that we can easily make strides to improve the experience for our patients. So what have I done to take these things into my life? Right now I teach the loving kindness meditation to my trainees. Quarterly we do a meditation session together where I teach them about this practice and I teach them the value of this practice. And I practice a habit of gratitude because I think that's been foundational for me and in my growth. So the things that I'm grateful for is I am profoundly grateful for the opportunity to mentor young people into our ranks. I get to choose, select, cultivate, and nurture young minds to become my future colleagues, to become our future colleagues. I get to do this with my fellows and with my registrars, residents, however you prefer to call them. This is an incredible opportunity to positively impact the world around us. I'm grateful for the opportunity to do what I love. It is an incredible gift to feel so much joy and personal satisfaction in what we do every day. And I'm grateful to share it with the people that I love. This is my husband here, who has frequently come into the operating room with me to film operations, and you'll see more of his videos, I'm sure, tomorrow. I'm grateful for the opportunity to travel the world, to learn from so many people. When you think about that small girl in that tiny town in rural Oregon, growing up so poor that we were stealing clothing from the thrift store, the opportunity to have been to so many of these countries and see so much of the world is truly extraordinary. And I'm grateful for the incredible friendships that have come out of that experience. In 2023, I met Tanya as our visiting fellow when I was in my practice in California. And over the years, we have maintained a connection and relationship, visiting each other in Toronto and in Washington, D.C. most recently. I know that that connection is why I ended up in this situation, and I still cannot believe you extended me the opportunity to talk to you all today, but I thank you so much for this, and I am so grateful for this opportunity to share part of myself with you. So from the hand surgery community, I add these final threads, that we never stop learning, and that what we do stronger together. We learn from one another, we grow together, and we support one another. Our life may not be easy, but it is profoundly rich and profoundly satisfying. I am so grateful for the mentors who have touched my life, and through Bernie O'Brien mentoring those who mentored me, and for bringing that thread into my life and connecting me to this community here today. I'm grateful for the patients who first gave me the opportunity to experience compassionate care and to experience joy in looking after those who needed us. And I am very deeply grateful for the final gift of my mother, through her passing, who taught me the importance of developing and strengthening this muscle and gave me a new view and a new perspective in life. And I will happily take questions.